Right, new details tonight in a KCTV5 News investigation. Last month, we told you about changes to organ transplant policy and how livers donated in our area are being shipped to other states.
Congressman Kevin Yoder is leading the charge now to change that. And investigative reporter Angie Racono explains.
Share 35 is supposed to save lives by matching the sickest patients with livers, but some communities have lower donation rates than Kansas. Here are some important numbers. 115 people had liver transplants at the University of Kansas Hospital in 2014. Last year, only 87. That's 28 fewer transplants after Share 35 began. Doctors have been sounding the alarm, and tonight they have political backing.
It's kind of like your life gets taken away.
Bill Ellery waited 579 days to receive a liver and kidney transplant. A young man sick and dying. He never thought about how organs are allocated, but his doctors certainly did.
Don't move things from our community to theirs.
Local doctors criticize what sounds like smart public policy, share livers regionally. Currently, there are 11 regions, but there's talk of combining regions and sharing even more. Perhaps 8 regions, and down the road, maybe only 4.
Our concern is that we want the organs that are donated by generous people here in the Midwest to stay in the Midwest.
Dr. Ryan Taylor says it's an uncomfortable reality. Some communities donate more than others. Those that give less benefit. Areas like Kansas that donate more lose.
Because there are some families that never get that call. They never get that gift of life, and we have to say goodbye to them, and that's very tough.
It's terribly frustrating because my constituents donate at some of the highest rates in the country, and I don't think they should be penalized for that.
Congressman Kevin Yoder is now adding his political voice, questioning the unintended consequences of Share 35 in a letter to the Department of Health and Human Services. 55 transplant centers in 25 states support Yoder's concerns.
Shipping organs around is ultimately not going to solve the problems we face. We do not have enough organs in this country for the amount of folks that are waiting for transplants.
Bill Ellery is one patient who has a happy ending. Here's Bill after his transplants.
I actually feel pretty good, like physically and spiritually and emotionally. I feel a lot better. And it was well worth the wait.
Many others still wait. There are more than 120 patients waiting for livers at the University of Kansas Hospital, and there's another 12 patients waiting for both a liver and a kidney. All of these patients and their families will be directly affected by Share 35 and regional models. Angie Racono, KCTV5 News.